All right, Laura, thanks for that. In your medical update now, artery disease can lead to strokes in some patients if it's not treated properly. Now, a procedure being performed at Middlesex Health is changing that. It's called transcarotid artery revascularization, or TCAR.
And here with more is Middlesex Health Chief of Vascular Surgery, Dr. Bart Moose, along with Middlesex Health Chief of Vascular Surgery, Dr. Megan Hsu. Thank you so much for joining us. We appreciate it. Tell us more about this disease, this artery disease.
So, stroke is one of the most common causes of death and disability in the United States. And about 1 in 5 strokes are caused from carotid artery disease, which are the main arteries that go and supply the blood to your brain. And if they get blocked or clogged, pieces can break off and cause stroke, or the blood supply can be limited and also cause stroke.
Are there symptoms that patients can look for, or once you have a symptom, is it too late?
Well, the most common symptoms that people have is called a transient ischemic attack, or TIA. And that's a temporary, can be 30 seconds, loss of vision in one eye, or sometimes slurred speech, or the temporary inability to move one side of your body.
So tell us about this procedure and how it's kind of changing the landscape. It's a new way of dealing with this.
Yes, so this procedure, which we call TCAR, deploys a stent via a small incision right above the clavicle or the collarbone, and it goes up and covers that area of blockage, protecting the artery and preventing any of that build-up from traveling up into the brain.
This is a new procedure happening at Middlesex.
It is new. Traditionally, there are 2 ways to take care of carotid disease. One is an open procedure where you would have an incision on your neck. We would go down, find that artery, and clear that junk out. And the other would be also a stent that would go through your groin that had a slightly higher risk of stroke. So this is a great procedure for patients that are higher risk, that may have some medical or anatomy limitations that would make it difficult to do.
And this makes Middlesex unique. It's not a procedure you're going to find everywhere.
So this procedure was approved by the FDA in 2015. And Middlesex Hospital, associated with some other hospitals around the state, are doing this procedure. So it's been available here in Connecticut since 2015, but actually Dr. Hsu was involved in the original trials of this procedure many years before that. And it was Dr. Hsu that brought this procedure to Middlesex Hospital.
It's fantastic. And what is the recovery time like for patients?
It's actually quite simple. Most patients, the procedure itself takes between a half hour and an hour. They're in the hospital for 1 night, and I would say 95% of our patients go home the next morning and really have very few limitations afterwards.
That's so quick, and it seems like it's making such a difference. Do you just hope that it just, really changes the landscape for stroke patients moving forward?
You know, I think that this is just one more tool that is in the tool belt of vascular surgeons to offer our patients. And when we have this many different options, we can tailor each one to each individual patient so that they can get the best care. So it's definitely an improvement and an advancement for stroke care here in Connecticut.
It's great that the procedure is available here, but are there ways patients can avoid having surgery? What should we do to prevent this disease?
So if you meet criteria to have a surgery, you can't often avoid it, but things that can prevent patients from progressing to that would be to keep a diet that's low in fat. The mainstay of treating most vascular diseases, making sure you don't smoke. And then there are certain medications that can help slow the progression.
And folks can always find out more on your website. It's middlesexhealth.org. Is that correct?
That's correct.
All right. Well, thank you so much for joining us here. Important information, and it's wonderful it's being offered here and so accessible.
Thanks for having us.
All right, stay with us. More CT Style coming up after the break.